All right, good afternoon. This is Dan Bell. It is December 11th, 2013, and we're here on a brisk, what is today, Wednesday afternoon. The sun is shining, the temperatures are cold, but here we are, and I am meeting with Dr. Sandeep Samudre, and I won't tell you what Sandeep is involved in. I'll let you hear that from him, but I can tell you that he is a young entrepreneur in the Chesapeake and Hampton Roads area, and he's got some great things going on. And Sandeep, thank you for allowing me to ask you a few questions.
Dan, thank you for having me. It's nice to be here, even though the sun's out. It's still cold.
It is cold, and it's a little chilly where we're at, actually, inside this building, too. He's doing some construction work on his facility, and things are in process. So, Sandeep, why don't we start with just asking you to talk about yourself, a bit of your personal background.
All right, so I'm a local and attended TCC, ODU, and Eastern Virginia Medical School. My personal background, I'm a scientist by trade, and I did that for a while and got a few grants out of it and developed some technology that I wanted to commercialize. So I made a foray into the business world, trying to commercialize that. So I guess I went to the dark side for a little bit as far as academia goes. But faculty at EVMS and several other local colleges, and I teach a variety of topics. And so when I started to commercialize this technology, it's a drug that alleviates glaucoma and glaucoma symptoms. We found out that there's nothing like that on the market, and so we started the process of getting this drug on the market. And let me tell you, it's been about 3 years now, and I'm still learning new things. So it's a long, drawn-out process, but it learned several lessons along the way, and everything goes back to the technology that was created. But also along the way, I've had the opportunity to actually implement my teaching background. I do teach at the local colleges, but we started something new here called Samudre Academy, and it's a pre-K through 5th grade school at this point. The reason I decided to open up the school was with the support of my fiancée, Vanessa. We were looking at how low we rank on the global totem pole in terms of math and sciences. I think we're down to number 35 now and slipping, and we needed to do something about it. And with my background in science and biology and some technology, we decided that we want to reinvent the curriculum. So we looked at different options globally, and found that there's nothing locally of this nature, so we decided that we want to take this venture on. So here I am, there's a couple of ventures here, the Samudre Academy and Technosite, which is a drug development, a medical device company, the only biotech company here in Chesapeake.
That's outstanding. I mean, obviously it's a huge field, and bigger and better things coming for sure. But also the whole thing about early childhood education, I think the statistic that we're used to hearing is that children's minds, they're 80% wired by the time they're 3 years old.
Absolutely.
And so there's efforts nationally, of course, internationally as well, but locally there was, I think, Elevate Early. Was it Elevate Early Education?
It's the E3
program.
Absolutely.
And so the opportunity then to address these young minds is just a remarkable thing. On the biomed side, it's daunting to me to even think about how do you bring a drug to the marketplace. I mean, we just hear about these things that it takes a dozen or more years.
It takes about 20 years for it to go from benchtop to the actual local pharmacy. But there's, with orphan conditions, for example, the process is much less, about 7 years, but it's still grueling. People don't really like to invest in long-term returns, or returns that take years and years and years, and so that's the downside, and it takes a lot of money to unfortunately get this drug on the market. A typical drug costs about $1 billion by the time it gets to the market, and at that point their patent life is running up, and so they only have about 3 or 4 years to make all the profit back.
Oh my goodness.
To make all that $1 billion that they spend back. So that's why your aspirin costs a lot of money.
Oh my.
At this point. And so I knew about the drug development process, but on an academic scale, where we apply for grants, the NIH grants, which we've been recipients of, and we look at it from the academic side, not really knowing what business wants. And then once you find out that this particular drug works for a condition, then the tough work starts.
I bet.
Yeah.
So now you've got another venture too, Eastern Virginia Eye Institute.
Yes.
And why don't you tell us a bit about that?
Eastern Virginia Eye Institute is an academic ophthalmology center. The only academic centers that exist are up north, Baltimore, Johns Hopkins, and down south by Duke. This area really needs an academic center because it has a lot of the resources, but not in a central location. So what we want to do is look at different ophthalmological conditions, diseases, and actually continue the research efforts that I started while at EVMS in a more constructive way with and actually a little bit of independence to apply for the grants, to go out and do the fundraising, etc. And actually bring in the business side, which would be the technique side, to actually commercialize a lot of these products. So we have a saying, we do pretty much everything from conceptualizing an idea to doing the bench work, the preclinical work, the clinical work, as well as the commercialization aspect. So with Eastern Virginia Eye Institute, we have both. We have the academic scientists that are not only doing the grant writing, bringing the funds in, but also doing innovative thinking on how to best resolve a lot of the ophthalmological conditions. And then we have the clinic, which we have the ability to do clinical trials in-house that reduces the cost of bringing the drugs to market, but also serves as a conduit for the latest and greatest information. And so if you have a tough condition or something that is still in the research phase and you want to benefit from that particular technology early on, we have that capacity. For example, we do electrodiagnostics. I think we're the only one in a 200-mile radius that does that. And it's not, the concept is still new to be adopted by the physicians in the area. So we're already offering that particular technology. And so the patients can be better served because of an academic center. So it incorporates both the contribution to the science and biotechnology, but also helping serve the community at best. And through the Institute, we also have a lot of philanthropic charitable work that we do, for example, coordinating with several local charities to assist veterans in their eye screenings. We all have a mobile care unit that goes out. It's a van that has ophthalmology, dental, and audiological equipment on board, so we can go into remote areas and administer care for those people. And so we're just much more than a clinic. And something that we've started here is called a Parallels program, which, if you come and get care at our clinic, whatever it is, eyeglasses or dry eye therapy, we'll parallel that to the community. So whatever you contribute by participating in our clinics, we contribute the same amount to folks that don't have access to care.
Wow, that's really something. So folks, this is happening right here in Chesapeake, right here in Hampton Roads, and It's an amazing story to tell, and to hear Sandeep tell about the distance that he's traveled in this sector, and the goals and aspirations that he has. So Sandeep, what kind of challenges did you face, and what were the hardest parts about launching these initiatives?
Everything. Well, it's running into the walls, and I think if you didn't run into any of the walls, you won't have an appreciation of what it takes to become a good businessman and to actually properly relate to your customers. And I think part of relating to the customers is you have to be the customer yourself and think about what kind of service do I expect from, for example, I'm going to pick on doctors. You going to see an eye doctor right now takes about a 3-4 hour wait. You just wait in the waiting room, and then you'll be seen for a few minutes, and then pretty much let go from there. But that's not a good thing. If you can get better care at Kohl's shopping for clothes, why not get similar or better care at your doctor's office? So we had to do a lot of thinking, and there's a lot of barriers, the bureaucratic levels, and the biggest barrier is funding. There's nobody out there giving you money to start. There are a few organizations, but you really have to do your homework on that. And the biggest wall is that I run into is, how can you differentiate yourself from the others? And for me, innovation is the key. If you don't innovate, you're going to fail. If you're just going to do some of the same, you're not going to survive. And getting out of that rut, and I hate to use the term thinking out of the box, but you really have to, relate, like I said, to your industry and to your customers, and that's the key. So.
Well, that's outstanding. You mentioned the financial elements, and obviously, as businesses start up, they look at small business loans, they look at bootstrap financing, sometimes friends, family. What advice can you give the newcomers in this area?
The biggest advice is it's not going to happen overnight. You have to put your time into it. Now, when I first started thinking about this is what I wanted to do, it was a long-term process. It was about 5 years. And for the last 5 years or so before actually starting this, I saved every dime, penny. I think I only had 4 pairs of clothes when I met my fiancée. She made a comment on that, but you know what? It didn't really matter at that point, because you're saving up money because you want to do this. And a lot of people I run into say, hey, don't put your money into it. Get a lot of investors, and I think quite the opposite. You got to have skin in the game. And if you don't, then you might as well quit and go take a vacation. But it was a long-term savings plan. I had enough money to finally quit my day job and start this venture. And my friends and actually my family, both Vanessa's parents and my parents, actually believe in this effort, and they're doing and contributing a lot of funds and their time to make sure that this is a success. So for me, it was a combination of personal savings and family. Now, the SBA has great programs, but we haven't been in business long enough to qualify for a lot of the programs, and in the future we will. So, but to get things off the ground, it needed to be bootstrapped, and that's where a lot of the funding came from. And like I said, it's not an overnight thing, and you need to be serious about what you're doing.
Absolutely. Well, you're doing it right. Along the way, we talk to young entrepreneurs, and oftentimes they have a mentor, or they have somebody that's assisted them, even in an emotional sense, not necessarily a financial one. Who's helped you stick to your goal and your vision?
Well, Dan, I like to surround myself with people that are positive thinkers, that are successful in their own right, because you are who you surround yourself with, and and I've surrounded myself with folks like you, Dan.
Oh, that's
and my biggest supporter, obviously, is my fiance and and her parents, who I can be honest, and I can vent. Venting is an important part of the process, and support of people that I know they have, good intentions, and they're willing to sit and listen. And I've also have good friends in the community that are successful entrepreneurs, and they've taught me a lot of things, because I do have a business degree in healthcare administration, so get a lot of theoretical knowledge from the degree. But when it comes to hitting the ground running, you need people as mentors that have been there, done that. So along the way, I've met quite a few folks that are willing to help somebody like me out, and also provide some needed advice. So it's good to listen to people that have been there, done that, and take their advice, as opposed to a lot of businesses fail because the CEO or whatever person in charge thinks that they can do everything by themselves, and they can't. They need an army of supporters, and I think that's important. And so as we go further in this venture, we're meeting quite a few people, and they're providing a lot of good insight. And so I'm taking all that in and applying. And so the key is being flexible. And you might not exactly implement what you've originally planned. Things might be a little bit different, but you got to be open to that change.
Absolutely, flexibility. Now, almost universally, a comment that I hear from entrepreneurs is that you have to be willing to take risks.
Yes.
What kind of risks? You've mentioned some. I mean, personal savings and such is a risk. But what other kind of risks have you taken along the way?
Well, the answer to that is everything. I risked it all. I've got everything in the game. For me personally, it means my professional credibility. At the institute, I've been trying to bring into new techniques that will help folks that suffer from dry eye. Some of the non-medically accepted things like acupuncture, and actually gone out and did the research, and it works. And so we introduced that concept. So that's a huge risk professionally, but the science backs up my claims, and we have some very happy patients. And so that's a professional risk, and this is all part of being innovative in the field. Obviously, the financial risks. I haven't paid myself in a couple of years, but
it's only money.
It's just money at this point. But I want to retire,
right.
soon, and I made it's part of that goal. I did not want to work for anybody else, and that's something that I strongly believe in, and no amount of risk can come in the way. So it's all I'm all in the game.
You're all in.
You're all in, and so. And it's paying off, so, professionally speaking, we have our papers being accepted. We just got an NIH grant. And so it's all about how you present yourself, and it's not just risk just for the sake of taking risk. It's a calculated risk. And so, I don't want to do this at a later point in my life, so I can absorb some of that risk at this point. So it's all good.
Very good. Let's talk about obstacles. Obstacles are fairly common in business and in life, but tell us about some of the obstacles that you've faced, not just in starting your businesses, but again, being in the biotechnology, bioscience field. There's got to be huge obstacles.
Absolutely. Dan, my bread and butter right now is grants. If I don't write, it's in what we call publish or perish. So if you don't publish anything, if you don't write any grants, you're not going to get paid. And the biggest obstacle was the recent issues with the government shutdown, where we actually got a very competitive grant, but we're not able to receive the payments because of the shutdown. And so that was a huge obstacle. Now the National Eye Institute, for example, only issues 2 grants every cycle, and I was one of the 2.
Congratulations for that.
Yeah, it was a huge letdown, but things are back on track now. But the whole funding for science grant has dropped. I mean, we're looking at less than 1% successful first-time grants. So, and the grant cycle is pretty big. So every 9 months, you're at the mercy of the funding agencies. And so there's not too many grants available. If there are, it's a huge competition. So that's a huge obstacle in my field. So you have to basically do whatever it takes to, be in business. And for me, it was commercializing some of those ideas. And so at this point, we have about 24 patents that we're filing, and so it's all part of trying to identify what we can commercialize and bring in a few bucks, and to continue on with the research and development.
In fact, that was one of my next questions: is any significant awards? Well, patents is a pretty significant award.
Patents pretty huge.
2 dozen of them is even bigger. So congratulations on that.
Thank you.
Lessons along the way. You've been at it for a few years now, and we gain experience and we learn from things that work, things that didn't work. What can you share with us?
Well, I think I mentioned early on, it's the flexibility. You have to be prepared to do everything, and I mean everything. And we're setting up our new office now, and things like cleaning the floors or installing the floors. It's a little bit of everything. I've done our websites. For example, I had to relearn how to code HTML because I didn't have the couple of $1,000 it takes to set up a website. It was all part of that. In addition to writing grants and giving talks. So that's the key. You have to basically be ready to do everything. There's no rest for the weary.
Right. Well, you mentioned talks, and as an aside, I want to tell the audience that Sandeep and Vanessa just recently organized a TEDx for women. It was called TEDx Great Bridge.
Yes.
And I was in attendance. I thought it was fantastically successful, and there were some great speakers. But give us a little bit of background on that.
TEDx is known globally for bringing communities together to put ideas into action, and they've done so successfully for the past 30 years. And the TEDx concept is more recent, and it's probably like the last 10 years where they have identified community organizers that can put together these TED-level talks in their own communities. And the intent is to bring the communities together again, to share the ideas, to inspire the folks to do great things in their communities. And I think from the turnout that we had on Thursday, it's been great. A lot of folks were inspired by the speakers, and they're going to go and do great things in their community. At least that's the hope. And so TED is a great format and platform, and we're honored to have that in our area.
And the speakers were wonderful. We had, first of all, Toya Sosa as our master of ceremonies, if I recall.
Absolutely.
And let's see, the speakers that you organized, Dr. Deborah DeCroce of the Hampton Roads Community Foundation on leadership. In no particular order, Kristen Fitch from Ziggity Zoom, Kathy Lewis. We also had Sharon Zala. She's a principal architect at PFNA. She had a great talk on how environments reduce stress. Right.
And we also had Dr. Camilla Okpodu from Norfolk State, and she had an amazing talk about STEM education and where we stand as a nation.
Yeah.
And I know a lot of people are talking about it, but she brought the house down with her brand of how things should work. And what a tremendous event. And Kathy Lewis, amazing.
Yeah, I thought they were all wonderful, and it went from, I think it started at about 3:30 and ended about 7 o'clock.
Yeah. Absolutely.
And Mayor Krasnoff of Chesapeake welcomed the audience.
Absolutely, it was great to have him.
And great partner in Chesapeake Public Library System. We we met at the Chesapeake Central Library in their large meeting room. So it was just a wonderful event. And congratulations to you both for putting that together. So let's talk about business in Hampton Roads. Certainly, one can say there's challenges everywhere, but what do you think about the business environment that you found in Hampton Roads?
You know, Dan, I traveled the country. I lived in many parts of the world as well, and Hampton Roads has always been home to me. And when I first thought about opening a business, it would have been in this area for a lot of reasons, mostly taxes, the access that you have to a lot of the big regions. For example, if I have to attend a business meeting in DC or even Philadelphia,
right.
I could just sit in the car and drive. You know, you don't need to find an expensive flight or anything. But
or hop that train now out of Norfolk. Right?
No, the train, absolutely.
That's right.
The train's actually better because they have Wi-Fi and I can get a lot of work done.
Yeah, that's absolutely correct.
And the other reasons is because, you know, as an innovator, there's a lot more to do in this area as well. So I can actually have an influence in this area if I do some innovative thinking, and that's part of the reason too. Now there are a lot of challenges, but for the most part we have a great start. The beach actually is not too far away, so there's quite a few times I've gone out to the beach with my laptop and
Indeed.
and gotten some work there.
Nothing better.
Yeah, actually.
That's right. Well, let's talk about business culture, expectations, your philosophy on business. Why don't you share your opinions on that?
Philosophy on business. You know, you always have to do the right thing. You know, I've been part of many ethical talks and et cetera, et cetera. But you can't take any shortcuts. And if you do, you lose to learn a lot from it. And then the biggest thing in business is knowing what your clients want and knowing how to satisfy their needs. And it's really difficult to do in the medical field because you have so many rigid things that you got to work around with. Insurance, for example, the wait times, etc., reimbursement levels. So even then, you have to make sure that you stand apart from the rest of it. So innovation, again, is the key, and flexibility. So we've done some good things. We've actually published a patient manifesto on our website because, you know, just speaking on terms of healthcare, you lose that family atmosphere. You know, you go to a mom and pop place for to eat, for example, in restaurants, and you have a special time there, but you can't say that about waiting in a doctor's office.
Right. That's right.
So the business philosophy, you know, you can't take shortcuts. You have to always do right by your customer, no matter what it takes.
Absolutely. So you mentioned websites. Let's see, you've got 2 or 3 websites out there, right? You've got Samudre Academy. Why don't you take us through that URL?
Sure. The one for the academy is samudreacademy.org, and it lists our philosophy behind education and what we value, what our students, what we expect from our students. I'll put it that way. The next website will be for Eastern Virginia Eye Institute, and that's evei.org. And that has a lot of the services, research, etc. that we're conducting here. And the last one is the Technosite, which we're a commercial entity that is looking into medical devices and drug development. So.
Very good. And back on Samudre Academy, Samudre is spelled SAMUDRE. Academy.org.
That is correct.
Well, very good. Let's shift gears and let's talk about workforce. Young people coming out of school, more mature individuals getting retrained to shift their employment. What are you seeing in terms of the workforce development efforts in the area and the candidates that you see coming through?
Well, Dan, there's no training like the workplace training, and so we're fortunate to have folks that are seasoned veterans of our industry. But as we start to implement newer technologies, for example, switching to electronic medical records, you need not really a deeper understanding of computers, but just enough to know where to find things, and that's been a downside for a lot of folks that have had 30 plus experience in the medical records, trying to switch to these systems. The younger folks know a lot about computers, but they don't have the experience that it takes to manage a patient's case, for example. So there's a balance for both, and at the Institute, we're trying to train our younger folks using our seasoned veterans and vice versa. So actually learning goes both ways. The older experienced folks rely on the younger folks for the computer technological help, and obviously it goes the other way.
Fantastic. We're just about wrapped up. Do you have anything that you'd like to summarize or in closing to share with the audience?
Well, I just wanted to point out a few things, and one of the things was, when you start out thinking about a business venture, you got to be really serious about it. But the one thing is that you have to be really good at what you do. If you're not, go back, get trained, because you are going to do everything at this point. So make sure that you are really good at what you do. The second thing is to have skin in the game. If you don't have skin in the game, nobody will respect you.
That's right.
Especially if you want to attract investors. That's the first thing they look at.
That's right.
And the big thing is that it's not a 9-to-4 job. I wish there were times I could go back to a 9-to-4 and leave everything behind, but this carries on till 2 o'clock, 3 o'clock in the morning, sometimes all night, and you really have to have the support of your closest family, your spouses, your friends, because there's times I've just gone back and not seen anybody for a week just because the grants were due that week. And so but those are the 3 big things that I see people either having or not having, and that actually determines your success.
Well, I think that's fantastic guidance. So I think we're done for the day. Sandeep, thank you very much for sharing your time with us and your views on business and the technology sector that you're in. It's an exciting thing to watch Sandeep evolve these businesses in Hampton Roads and specifically in Chesapeake. And my vision for your future is that you're going to be a larger and larger component of this region's success.
We're trying to.
All right. Well, once again, thank you very much. And this is Dan Bell signing off for today. Thank you.
Thank you.